Good night, everybody. My name is Derek, and I'm going to be talking about the cardiovascular risk reduction with icosapent ethyl for hypertriglyceridemia. Definition: patients with elevated triglyceride levels are at increased risk for ischemic events. Icosapent ethyl is a highly purified icosapentionic ethyl ester that lowers triglyceride levels, but data are needed to determine its effects on ischemic events. Despite adequate statin therapy, there remains a substantial residual cardiovascular risk of cardiovascular events. In such cases, elevated triglyceride has been found to be an independent indicator of increased risk of ischemic events.
Elevated triglycerides are an independent marker of increased ischemic risk. Icosapent ethyl, a highly purified and stable EPA ethyl ester derived from fish oil, lowers triglyceride levels. However, it's not known whether it reduces ischemic events. In this multi-center randomized double-blind placebo-controlled trial, 8,179 statin-treated adults with persistently elevated triglycerides and established cardiovascular disease or diabetes, and at least one additional cardiovascular risk factor, were randomized to 2 grams of icosapent ethyl twice daily or to placebo. The primary outcome was a composite of cardiovascular death, non-fatal myocardial infarction, non-fatal stroke, coronary revascularization, or unstable angina. The key secondary outcome was a composite of cardiovascular death, non-fatal myocardial infarction, or non-fatal stroke. After a median follow-up of 4.9 years, the primary outcome occurred in significantly fewer patients in the icosapent ethyl group than in the placebo group. The key secondary outcome also occurred in significantly fewer patients in the icosapent ethyl group than in the placebo group. Hospitalization for atrial fibrillation and flutter was more common with icosapent ethyl. Serious bleeding was slightly but not significantly more frequent in the icosapent ethyl group. The authors conclude that in patients with elevated triglycerides, despite statin therapy, icosapent ethyl significantly reduces the risk of ischemic events. Full trial results are available at nejm.org.
Applications in medicine. Icosapent ethyl is a highly purified and stable EPA ethyl ester that has been shown to lower triglyceride levels and is used as an adjunct diet in adult patients who have triglyceride levels of at least 500 milligrams per deciliter. Icosapent ethyl may have anti-inflammatory, antioxidative, plaque stabilizing, and memory stabilizing properties.
I just want to highlight one other recent study that you presented at another meeting at the Society of Cardiovascular Angiography and Intervention, because I think understanding what you called reduce it, revasc was very important in demonstrating both time to PCI reduced by 32% and time to bypass surgery reduced by 39%. And I do think that's the first time we've seen any therapy reduce the risk of bypass surgery. So I think that when we talk about, greater than 30% reductions in revascularization on top of that, I know we have experts with cost effectiveness, but those are both expensive and potentially life-threatening interventions that we really have a robust benefit across multiple subgroups in the Reduce It trial.
Pros and cons. Pros: we hypothesize that the risk of cardiovascular events would be lower with icosapent ethyl therapy than with placebo among patients in whom elevated triglyceride levels serve as a marker of residual risk despite statin therapy. Cons: a larger percentage of patients in icosapent ethyl group than in the placebo group were hospitalized for atrial fibrillation or flutter.
The Reduce It trial was looking at a subset of people with diabetes, and they were looking at the value of adding icosapent to ongoing evidence-based treatment, including statins, and looking at expanded MACE outcomes. What they found was that actually the addition of icosapent reduced both primary and secondary outcomes in these patients with type 2 diabetes and cardiovascular risk. Now, why this is important is that now we know that we have another agent to add to our armamentarium to reduce the #1 cause of death. And it is worthwhile to take the time to reduce triglycerides after you maximally provide benefit from a high or moderately high intensity statin.
Issue applied in Ecuador. In Ecuador, it is indicated for all those who wish to proactively control their health, as well as in the following situations: patients with cardiovascular diseases, patients with chronic diseases, including NOMA, metabolic, immunity, or inflammatory disorders, patients with low mood or depression.
Well, there are a lot of different reasons. One is that many people have an unhealthy diet or don't exercise enough or are overweight or obese. But even beyond that, there are many different risk factors for cardiovascular disease that are highly prevalent. Things like diabetes, high blood pressure, smoking, and in particular, high cholesterol. And we've been really effective, I think, in terms of targeting high cholesterol with the use of statins. Those are medicines that are proven to reduce cholesterol and the associated risk of heart attack. And most recently, what we've discovered in a large clinical trial called REDUCE IT is that triglycerides are also a risk factor for heart disease. These are sort of like cholesterol, a fat in the blood, but a bit different. And in the REDUCE IT trial, we found that a prescription medication called Icosapent Ethyl reduced the risk of things like heart attack and stroke and dying from those causes by 30%. So a pretty large reduction in risk in people with elevated triglycerides who also have other risk factors for heart disease.
Conclusion. Among patients with elevated triglyceride levels, despite the use of statins, the risk of ischemic events, including cardiovascular death, was significantly lower among those who received 2 grams of Icosapent Ethyl twice daily than among those who received placebo.
I think REDUCE IT is a phenomenal trial. It's a game changer because it's the trial for the first time that has shown that triglyceride reduction with an appropriate therapy, in this case, pure EPA, icosapent acid preparation, when used in adequate doses, can make a significant difference. And this is very important because we have had mixed messages before. We have trials such as VITAL that was presented in the same session. We have the ASCEND trial that I was present in at European Society of Cardiology, and those are both negative. Part of that is because that's not a pure omega-3 EPA. In addition to that, they did not use appropriate doses. So REDUCE IT, use the appropriate doses, high, but 2 gram BID. I think it gives an important message. So we can do lots of trials, but if we don't use appropriate doses, we are not going to see the benefit. And that's one of the reasons some of the previous trials have been neutral or negative. And REDUCE IT really is a game changer because it shows for once when you use the pure EPA, icosapent, that you can show the benefit on top of maximal tolerated statin therapy. And actually, if you look at the forest plot of the study, I must congratulate the investigator for really looking at it, and across the board, you see the composite endpoint that showed 25% reduction. You also see a reduction in myocardial infarction by itself. You see a reduction in combined hard endpoints. You see a reduction in combined endpoints that include revascularizations. So across the board, everything is on the favorable side and very tight confidence interval. So this is a phenomenal study, in my opinion. And finally, establishing a triglyceride theory that we have been struggling with. We know it's a marker, particularly when you're dealing with high triglyceride, but we did not have any therapies because we have had negative trials with fibrates. We have had NIH-sponsored a core trial, which did not select appropriate patients and all that. And then we have the ASCEND and the VITAL trials that use the fish oil, but all fish oils are not created alike. And this trial emphasizes that when you use pure icosapent, then you are going to get the benefit, and you have to use the appropriate dosage. So it's not equating. One should not equate. That's a very natural thing to jump to conclusion. Well, if one helps, then all the fish oil preparation should be helpful. That will be a mistake. We have been down that road with many other products, with the statins, with other drugs like ACE inhibitors, calcium channel blocker, beta blocker. They have different effects in different kind of setup. So that's very important thing to keep in mind.
That's all for now. Thank you for your time and attention.